Hello and welcome to this edition of City Hall Insider. I'm Jim Marshall of the New Bedford Cable Network, and joining us in studio today, Damon Chaplin, the director of the New Bedford Health Department. Another appearance on the program here. It's been a couple of months, but thanks for joining us again.
No problem, Jim.
As we tape the show today, obviously we're beginning the summer season. Great time to be in New Bedford. Usually you'd have a lot of other things on your plate right now, health related, as we come to this time of year, but the last few months have been a challenge for everybody, and I know that have really taken up your time focusing on the COVID-19, the coronavirus. And as you look back from where we were back in, I guess, late February, early March to where we stand now, where do we stand now? How are we doing?
A lot better. Our numbers have stabilized over a period of time. We've gone through our first surge. Hopefully there won't be a second surge, or if so, it's a mild one. Our numbers, again, have stabilized to a point where we can actually start to put systems in place to kind of respond to and address some of the needs in the community.
From your standpoint, for your job, and obviously we've seen you at press conferences, and I've talked to you as whatever. When you look back when this thing first started, and you look where we are now, did you even see a roadmap at that time, or this has just been such a challenge for everybody.
Yeah, it was a lot of hurry up and wait because we didn't have systems in place to really deal with this type of disease. We haven't seen this before in the country, in the world, in public health. We just haven't seen these type of numbers before. And it affected so many different demographics at one time that it was just really unusual. And so it was a lot of work putting systems in place. I think we have a lot more systems in place now, both federal, state, and local, that we didn't have back in February and March.
And you've had a career in public health, so it's just amazing the impact that this virus has had, that people who have had the experience that you've had, this is just completely new.
Yeah, it's new in the sense that it hits everybody. Typically when we have an emergency event or an emerging event, there's certain sectors of populations of people that get affected, but this is hitting everyone at the same time. And so, although we have seen disparities in outcomes from the disease, everyone has to respond and has to be responsive to it because it's affecting everyone.
I chuckle now because I distinctly remember before late February and early March, you and I were talking on the phone because you wanted me to emphasize, because we had done the PSA on the flu shot, just people getting the flu shot.
Yep. And
it just seems so small now that we were talking about that, just getting your flu shot, and then this just hit. It just, how things change that quickly.
Yeah, we're moving at the speed of change. Yeah. And so, 3 months ago seemed like a lifetime ago compared to the amount of information and science that we've been able to accumulate for the COVID virus. And our strategies have changed drastically from when we began to where we're at now. And so we went from a place where we were talking mostly about communication, contact tracing, and isolation, to now where we're moving to testing. We want to get to a system where we have adequate testing for everyone so they can properly isolate and take some of the matters into their own hands.
You seem, and I know we've chatted before about this, it's a very good collaboration that the city has in dealing with this. You've got a lot of different folks, the hospital, the health center, obviously the mayor, the point person on this, but you've got a lot of different pieces that help you help the group make informed decisions, and that's got to be obviously beneficial to everyone.
Yeah, in addition to the mayor's leadership, which have been strong and it's been very helpful, and I think it is a big piece of what has allowed us to move forward. We've also seen individual leadership from the Community Health Center with Cheryl Bartlett, and we've seen individual leadership from South Coast with Keith Hovind. And we've seen individual leadership from all the other first responders, Chief Cadero, Chief Kader. And so all of us coming together as a COVID response team have been able to work together and solve problems as they arise. And so I think that's been the key to our success so far.
Do you think, because we're months into this now, do you think you'll have issues that arise that you don't foresee? It seems like you have a better grasp on how things are going now, or anticipating what might happen. Do you expect still some things to come out of left field?
Yeah, we do. We have the combination of, the world doesn't stop because COVID is here, right? We still have to worry about mosquitoes and Triple E and all the other things that go along with reopening up the state. And so what we are focused on now, again, is clusters. We're trying to monitor clusters and get ahead of clusters before they happen, whether they be in restaurants or any of the other spaces that have been reopened over the last few phases.
Talk to us now about, as you look back here, what has been successful? What have been the things that you've been not most proud of, but the things that have really helped in keeping the virus, I don't want to say at bay because it's here, but just limiting the damage, I guess?
Tracking, contact tracing or tracking, masks, wearing masks, and then just being really diligent about social distancing and hygiene. I mean, those things I think have been the difference for us as a community. I think as a community in New Bedford, we've done a good job of following the guidance from the state and local health department. The mayor, again, has come forward with the Board of Health to issue somewhere in the range of 6 to 7 emergency orders that have really tackled those specific sectors that have been impacted by the COVID virus. So we've been able to be cooperative, but we've also been able to be strategic and prescriptive in our response.
And it seems, at least in my eyes, it's the simple things that you're talking about that really have the impact. I mean, the mayor still talks about not that it has changed, but social distancing, he still pounds that in when he does his robocalls, when he talks to people, social distancing, wear the masks. I mean, those seem like simple things, but they do seem to be having that impact that you're looking for.
Yeah, it's because when you put the power of healing or the power of cure in the hands of the people who are affected most, which are you and I, simple things like social distancing and wearing masks are things that you and I control, and with that we have a whole lot of power over the risk of us becoming infected.
Is there anything that, as you look back on, that maybe you wish you had changed, or anything that you might have looked back on and said, no, we should have pivoted this way?
Yeah, I wish we had gotten testing sooner.
Okay.
In addition to PPE, I mean.
But the city seemed to have done pretty well with the PPE. You didn't see the distress in New Bedford that other parts of the country saw. It seems, and I don't know because obviously I'm not familiar with the inner workings, but you didn't hear that cry, I guess.
Yeah, I mean, I think we underestimated the impact of masks.
Okay.
And so we got masks, I think sometime in April. I think we began to do the mass distribution of masks from Joseph Abood. We just happened to be fortunate to have a tremendous company like Joseph Abood in our backyard who was able to assist us with the primary prevention technique, which is wearing a mask.
And how many communities can do what the city did by giving the opportunity for every resident to get one?
That's rare. It comes down to relationships and cooperation. The mayor and Joe Bahina from Joseph Abood, they have a relationship that allows the city to leverage the asset, which is Joseph Abood, for the city residents. So it worked out. And
you talk about testing, and then you said that's one of the things you wish you had more of. But in a sense, you're kind of that was kind of out of your hands as well.
Yeah, it was. I think the two things that I think that the one thing that we saw early, and the thing that we'll be tracking going forward, is disparities in testing. We understand that the most vulnerable populations were given the tests in the beginning, but that left a significant population of folks who were not able to get tested. Those folks who were asymptomatic, or those folks who did not see their primary care physician on a regular basis. Those folks, because they were not able to get tested, were not able to adequately isolate themselves within their homes or within their communities. And so we're watching for a similar pattern. We're hoping that we're able to get vaccines out to everyone sooner than we did with testing.
And right now, as we talk, how is testing in the city? Is it where you want it to be?
Yeah, we were waiting for that benchmark. We reached that benchmark about a month ago of just about 10% of the population have been tested now. I think we're just over 12,000 tests have been administered, I believe, within the city, somewhere in that range. And so that's a much better place than we were 3 months ago when we were just over 1%. And so with those types of numbers, it's really hard for you to do any strategic planning around COVID because you don't have any numbers in place to really help you make those decisions.
Speaking of tests, is it important, like me, I've never had a test. I don't believe I've had the symptoms or anything to require a test, and I know that they say, that you want people who have symptoms to get the test. Mm-hmm. But is it important for everybody to get the test eventually?
It is, because in my opinion, the tests allow us to identify those folks who are positive. And without being able to identify who's positive, you can't properly isolate your communities. And so the testing is not just for those who are negative, but it's more so for those folks to identify those who are positive.
If you take a test now and it comes up negative, does that mean you didn't have the virus back in March?
Not necessarily. So if you took a test now and it came back negative, that means that you don't have the virus in your body now. You don't have the proteins for the virus. You could have shed those virus proteins, and you could have been positive. It depends on how long ago you were, and have shed those viral proteins by now. So what we're looking for now is the serology tests.
What's that?
So the serology test is the test for antibodies.
Okay.
And that will let us know if you've been exposed and if you have recovered.
So there's a difference then between the antibody test and the COVID test. Is that accurate?
Correct.
Okay.
So the antibody test is the blood test that's testing for antibodies in your blood.
Yep.
And the nasopharyngeal test is a test for viral proteins.
So when you talk about testing, and for example, say in my case, what's the better test to get?
Depends. If you are someone who has been symptomatic or you feel like you've recovered, then you would probably want to get the serology test to see if you have the antibodies. If you're someone who has not been exposed yet and you feel like you have been exposed, it's probably best for you to get the protein test.
And from your standpoint, and I may be really simple too, but why are those important? How are those helping you in the department get the information that you really need to keep track of what's going on?
Well, it allows us to communicate with the public. I mean, when we know someone who's tested positive, it allows us to do contact tracing, which allows us to notify the folks who may have been exposed to that positive person, and then also allows us to give information to that person about isolation procedures for them as well. And so the testing allows us to begin the communication process.
We're talking to Damon Chaplin. He is the health director here in the city of New Bedford, who's been very busy over the past few months, to say the least. I think the city's done a great job over the past 4 months. You see other communities struggling, other cities struggling, and New Bedford seems to be doing what needs to be done to just have just try to keep the impact down as much as it can. And it is an invisible enemy. You just don't know what's going on right now with the virus. Do we know that the virus changes or anything as it's developed?
Yeah. So I haven't read in this literature yet that suggests that this is mutating in a season like the flu. Right. We assume that it would operate similar to the flu. It's the SARS virus, so it would probably, we believe that it will operate similar to the flu. So next season there may be a different strain of COVID. We don't know yet.
And it's funny, again, we go back to the social distancing. It just seems, you see businesses in different places and people keeping that 6 feet just seems to make the biggest difference in the world.
Yeah, it's so as we approach the summer months and people are beginning to get out more, we're seeing our numbers drop and dip We believe as a result of people social distancing naturally from just being outside. We just ask that folks make smart choices over the holiday weekend. This coming up being the 4th of July, where they'll have a lot of cookouts. We prefer people to be out versus in. If you can be outside, be outside. We prefer people to be in smaller groups than larger groups. And we prefer those groups to be socially distanced if possible. And at all times have a mask with you. If you feel as though you're in a situation where you can't properly social distance, please put your mask on. Make sure that you wash your hands. Be diligent about personal hygiene. I mean, all the things that you do normally, we just ask that you do it more regularly.
There's been a lot of talk about, wearing the mask, and I remember Governor Baker talking about, for example, runners, and he was asked, he said, look, if you're up at 6 in the morning, chances are you're not running into a lot of people. Yep. You're probably okay not wearing a mask, but if you're going out at 5 o'clock in the afternoon when people are home from work, you probably should wear one.
Correct.
So it sounds like, for lack of a better word, it comes to common sense, really. Know where you're going and know what you're going to encounter as far as social distancing or just the amount of people that are going to be there.
Yeah, I strongly, always have a mask on you, available. Wherever you're going, carry a mask with you. And it does, it is common sense, but in reality, these are new social norms that we're putting in place. People aren't used to carrying masks with them. People aren't used to social distancing. So although it is common sense, it's not what we normally do. We normally stand much closer than 6 feet from one another. And so those distances aren't normal distances right now. So you have to be conscious and you have to be aware. You just have to stay aware of your surroundings, stay aware of your personal space. And then, again, if you're going to a cookout, bring the hand wipes for you and your kids and your loved ones. Make sure you wash your hands when you come out of the bathrooms. Be vigilant about your personal hygiene. If you're putting on bug spray, make sure you have your hand sanitizer and keep your mask around you at all times.
You were talking off camera when we were meeting, talking about it, but you're talking about nursing homes. How are we doing there now?
Yeah, we are working really hard to put some systems in place for some cyclical testing for our nursing homes. 60% of our fatalities have been from folks who live in nursing homes. And so it's a space where we like to see a greater effort from ourselves and from the nursing homes and from the state as well. It's a space where we have a very vulnerable population that needs a lot of assistance. And so we have been working with our nursing homes. We meet with them weekly to discuss, their census and to discuss, how they're doing and anything that we can do to support them. So, we're doing everything we can to provide support to our most vulnerable populations.
Is it because of the underlying conditions they have? Is that why that's a difficult area for not just New Bedford, but for everywhere?
Yeah, it's a combination. They have comorbidities. The second thing is that they're older, and so they have a weakened immune system to begin with. And the third thing, they're living in a communal space. And so those communal living and work situations are situations that are very are at high risk. And so those things compounded on one another, they create for a very risky situation for our elders.
And I mean, we covered the press conference where the mayor, made the order to restrict access to nursing homes, and he talked about businesses as well about, keeping the social distancing. I mean, the city's been very proactive in addressing the issue as best they can, really.
Yeah, it's as those communal workspaces, those communal living spaces. Those are a whole sector of our vulnerable populations within the city, and so the orders that we have drafted between the mayor and the Board of Health, they've been targeted to address those issues around communal living spaces. Those are the spaces where we think we're going to see, we expect to see the highest number of clusters.
Do you think things as we go into the summer here, over the next couple months, do you see things, I don't want to say turning around, but us getting better, the virus lessening the impact?
Depends.
Okay.
Depends. If we do a good job of social distancing, hand hygiene, wearing masks, and being smart in our situations, then I think we'll get through this just fine. Even through the flu season, I think we'll do better because those things help even with the flu.
And when does flu, just for people too, when you talk about flu season, when are you talking about when is flu season?
Typically it's September to just about November when we start to see the numbers kind of rise.
Now, will that be difficult if people think they have the flu versus if they think they have the coronavirus?
Well, some of the symptoms are very similar.
Exactly,
So yeah, it would be. Again, testing, you need the test to be able to identify whether you have COVID or just a regular flu. In a lot of situations, the response is going to be the same. Isolate yourself, quarantine yourself if you've been exposed, and then the time frame is 10 days for those folks who are positive and 14 days for those folks who believe they've been exposed.
The one thing that you've been active too in, because you've contacted us here and we've done a lot of PSAs and promos and stuff in foreign languages too. I mean, you as a department have really reached out to the community as a whole to try to address this issue, the communication issue.
Yeah, so one of the areas, like the rest of the state, where we've seen the highest rates of disparities has been between our Black and Hispanic populations, particularly in New Bedford. Even though our Hispanic population is somewhere between 25 and 30% of the population, they represent almost 45 to 50% of the folks who are positive. And so we've been really vigilant about reaching out to those communities. We've gone to the fish houses where many of them are working, and we've also reached out to the Latino pastors where many of them go to church. And so we've talked to them about putting those safe practices in place for both of those locations, and fish houses and also in worship, places of worship.
Over the next few weeks, you are going to be, obviously, with others, talking about school for next year. And I know you're a dad, and you've got two in school right now. And I know that, not being in school is an issue for the kids, like mine. They want to go to school in a sense and do their sporting events and see their friends and stuff like that. But so you guys are going to have to come up with some sort of game plan, I guess, to what school's going to look like come September.
Yeah, the early education, the folks from early education, they've kind of set the groundwork for some of the strategies that will need to be considered for the reopening. But again, we really can't make those decisions until we figure out how many people or who's going to be in the buildings. So that's got to come first. What is their strategy for whether they're going to have folks in school in person or they're going to go virtual? And so once those decisions are made by the school department, then we can talk about mitigation strategies for COVID going forward.
Do you think that there'll be some sort of combination, I guess, that some kids, during some days the kids will be in school and other kids will be virtual? I mean, it seems just in general that it's going to be hard to get that many kids in any schools right now.
Yeah, I think they're going to have to, at the very least, do a combination
Yeah.
of in-person and virtual, but that makes for a much longer day or a much longer week. And so, there have to be some considerations as to, and then also I assume that they're making other considerations as well as around how do kids learn. Some kids don't learn very well through virtual, and so that has to be taken into consideration as well. So they, we have to wait for them to make a decision on what's best for the kids in their schools, and then we support them with what we believe are recommendations from a public health perspective.
You are a sport nut, I know. You love sports.
I do.
Because we've talked about sports. How do you see youth sports or sports just coming around in the next few months? Or do you see it coming around?
Yeah, that's a great question. Well, if you look at the professional leagues, baseball, basketball, and football, those close contact sports, those sports where folks are forced to be in close proximity, it's going to be concerning. Oftentimes, if you played sports, it's almost inevitable that some body fluid is going to be transferred between people at some point. And I don't know that if testing everyone before they play is a requirement. We haven't talked about those requirements from a public health perspective yet, but I assume testing will be a big piece of that.
And it's funny because you look at tennis, for example. To me, tennis seems different than football, just the contact.
Very much so, and it's not as close contact.
Even baseball to me has less contact than most other sports, than a basketball or football or something like that.
Yeah, I would imagine the percent of time that you spend less than 6 feet away from a person in a contact sport is very small. I mean, very large.
Yeah.
Meaning that you spend a lot of time within 6 feet of one another. And that in itself increases your risk. And so one of the ways you can mitigate that is to make sure people are tested before they start, and isolate those folks that are positive. But going forward from there, I'm not quite sure how do you do that safely.
We talk a lot about the physical aspect of this, but obviously you're health director, and I know you deal with the mental health of things too, and this mentally has had an issue on people, just their psyches. How important is it from your standpoint to see kids playing sports, or to just do some of the regular things that they did before this? How important is that just for the mental aspect of it?
I mean, for the kids, I think the kids are resilient and they find ways to entertain themselves regardless of the situation. You see a lot of them who are walking now, they're doing other things like biking, or they're doing things to keep themselves busy. And this is fortunately for us, at the time when we hit our peak or our surge, it was during a time when people could get out of the house and they could walk around and be out a little bit more, versus being stuck in the house in the middle of the winter. But for the adults, mentally for the adults, I believe it's very draining. Because number one, you don't know. You're walking around with this fear of, do I have it? Am I around someone that has it? And this constant fear of whether I've been infected or not. And that in itself begins to wear on folks. And you see it. I mean, you see it with people, and their anxiety is up. It's higher. We can hear it in the phone calls that we get from folks who are concerned. It's taken a lot. It's taken a toll on the community in general, in a large way.
And back in March, you were telling people too, I remember here, that they should get out. They should just basically walk around too, just get fresh air. That's good for them. Yeah,
it is. And again, we were thankful. We were, lucky that this happened at a time when the weather was just starting to break, when folks could get out. Even though it was wet and it was still cold, you could get out and take a walk. The cabin fever is real. Once you've been stuck in a location for a long time, it's real, and we see it. We're trying to figure out ways to allow those folks who have been stuck inside to even get visitors and have that human contact. That's a big piece of that mental healing.
We've got about 20 seconds here. I just want to give you a chance, and I might have cut you off earlier. You're optimistic, though, about the next few months.
I am. I think that we will do better in the next few months than we did in the last few months if we follow and we learn from the lessons that we had before, which are make sure that we social distance. Carry your mask with you, wear your mask when you can. When you feel as though you can't social distance, make sure you put your mask on. Make sure you practice good hand hygiene. And then in all situations, be smart about your choices.
It's good seeing you. Keep up the good work.
Thanks, Jim.
We'll talk to you again.
All right, no problem.
That's going to do it for this edition of City Hall Insider. I'm Jim Marshall. My thanks to Damon for coming in and talking to us and updating us. And we'll see you again soon.